Hello, I'm Dr. Maurie Markman from City of Hope, and I want you to briefly discuss a very interesting, very provocative study, implications of which obviously will need much more conversation in the future. Referring to a paper that was published in Cancer 2024 entitled Cardiovascular Disease and Stroke Following Cancer and Cancer Treatment in Older Adults. This was not a cancer-related study. The study was entitled Aspirin in Reducing Events in the Elderly, ASPREE. This was a secondary analysis trial because the primary analysis of the trial was to actually to see if aspirin will have an impact on these events, cancer being one of them. But what they did was in the secondary analysis looked at patients who entered the trial who did not have cancer and did not have any cardiovascular disease at entry. These were patients or individuals. They weren't patients at the time because obviously they didn't have an illness, these illnesses. They were accrued from Australia and the United States. There were 15,454 individuals in this study, of whom 1,392 developed an incident cancer while on the study. Not terribly surprising, considering the fact that this was an elderly population went into the trial. And what the investigators did is they looked at the rates of cardiovascular disease that developed in individuals who had a cancer discovered versus those who did not. And they lumped together in their analysis the cardiovascular disease of myocardial infarction, stroke, or heart failure. What they found was, strikingly, that in the individuals who developed cancer, there was twice the risk, say that again, twice the risk of developing cardiovascular disease compared to the population that did not have a cancer. And very important to point out, aspirin had no effect. So whether the individuals were on the group that received aspirin or did not give aspirin, that did not impact the risk of cardiovascular disease that developed. Again, interesting. Obviously, one must be concerned about the potential impact of the treatments these individuals receive for their cancers. Again, the numbers are relatively small in that sense, 1,300 to break that down. But whether it's the treatment, other effects of the cancer that might have had. But again, doubling the incidence of cardiovascular disease in the presence of developing cancer. An interesting analysis. Obviously, one would like to see more data on this point. One would like to tease out why this might have happened. But as cancer incidence goes up, as the population gets older and there's more treatment given to the older population, this is obviously something very important to keep in mind. And I thank you for your attention.